Amani,
Yes.
you can go ahead and start.
Hello, my name is Imani Marks, and I am the Nurse Director of Clinical Services for Community of Hope. And tonight on Ask Dr. Al, we'll be discussing some topics regarding pediatric COVID vaccines. For those of you who are new to Community of Hope, we are a community health center located in Washington, D.C., with 3 locations providing behavioral, medical, and dental services to patients regardless of insurance status or ability to pay. We also run a family success center and programs to end homelessness in the Washington, D.C. area. As a community health center, we have been at the front line of the community COVID response, and we've given over 10,000 vaccinations and performed over 10,000 COVID tests. So tonight we have two very important people. Dr. Al Ballard, he's a pediatrician with Community of Hope and also the Chief Medical Officer. And we have Latoya Matthews, who is not only a community parent, but also our Family Success Center coordinator. Dr. Al, I'll go ahead and turn it over to you.
Thank you. Thank you, Amani. It's really good to be here, and it's really exciting to talk about the availability of the Pfizer pediatric COVID vaccine for kids aged 5 to 11, something that we've been waiting for quite some time. As you know, we started the vaccination process a little bit over a year ago, and we were talking at the beginning of this about how we all got our vaccines last year at this time. And so it's really exciting to be able to offer that to our youngest, most vulnerable patients. And as you know, we've also given over 300 doses of this vaccine to our patients, and they've been tolerating it extremely well. We now know that children in this age group can get sick. At the beginning of this pandemic, we didn't think that it really affected younger kids. We really thought that this was something that affected older folks, but now we know that kids can get sick just as well. Some of them even requiring hospitalizations and some even dying from what is now considered a vaccine preventable disease, just like measles, just like mumps, chickenpox, and all the other diseases that we vaccinate for. So we at Community of Hope want to make sure that families that we take care of have access not only to the vaccine, but also to the information that they need about the vaccine. And that's part of the reason why I'm really excited to be here. We're doing our part to get our children back to school in a safe and healthy in-person learning environment, because we know how important it is for kids' emotional and social development to learn in person. And so a significant part of that is making sure that they're vaccinated and protected against this disease. So I'm thrilled to be a part of this conversation and look forward to talking to you.
Thank you, Dr. Al. And then before we move on to Latoya, I did just want to remind everyone that you can view this program on all social media platforms: YouTube, Facebook, Instagram, and Twitter. If you are joining us from Facebook, Instagram, or YouTube, feel free to submit a question and we'll answer them through the live. Latoya, would you like to go ahead and introduce yourself to everyone?
Good evening, everyone. My name is Latoya Matthews. I am a community parent. I've lived in Ward 8 pretty much all my life. And I also am the Family Success Center coordinator at the Bellevue Family Success Center at Community of Hope, where we provide access to resources and services.
Thank you, Latoya. So I'm going to go ahead and turn it back over to Dr. Al. He's going to talk to Latoya about her family and her reasoning for getting her children vaccinated, and also discuss or even answer some questions that you all may have.
Fantastic. Thank you, Imani. So Latoya, tell us a little bit about your family, your kids, their ages. Get us started with that.
Sure. So I'm a mom of 4. I have a 15-year-old, 14-year-old, and 9-year-old boy-girl twins.
All right. So you sound like you're a busy person outside of work as well. So excellent, excellent. And can you tell us a little bit about your experience at this point with the COVID vaccine? It seems like you have some teenagers who were in that in that second group to get approved, and now you have some younger kids who are in this last group to get approved. So tell us a little about your experience with the vaccine so far.
Indeed. In all transparency, in the beginning, I was like, okay, I'm gonna get vaccinated because I know that I'm around people a lot, and I just didn't feel comfortable with vaccinating my children at
Yeah,
first.
sure.
And then it started to become prevalent that it was important because my children wasn't able to participate into sports, my 15-year-old, because unless she was fully vaccinated. Um, and then I started to see more children be affected by
Yes.
the vaccine because I wasn't seeing a lot of that at first. So then I was like, okay, well, let's get you vaccinated. She was okay with it. She didn't put up a big fight about that. Um, my 14-year-old, she's not really that keen on it. So I'm working on educating her about the vaccine so that even if it's not ideal for her, she understands the importance.
Yeah, and that's an important part of the sort of the independence development in teenagers, because your approach to your teenager might be a little bit different than your approach to your 9-year-old. Just a couple of things that we recommend, particularly as healthcare providers who take care of teenagers. One of the things that we always encourage parents to do is talk to them initially about the safety. Just really reassuring them that it's a safe, effective vaccine, because there's a lot of misinformation out there, and oftentimes they hear things from their friends, they read things online, and so generally speaking, parents and adults, guardians are the best source of information for kids in this age group. So really reiterating safety. The second thing is debunk the myths. It's always important to ask open-ended questions and to respond to those in a non-judgmental way. Um, Ask them, what have you heard? What are your concerns? What are your friends saying? What did you see online? And so really sort of creating that space where they can be open and honest and not feel judged by any of the questions that they ask. And then the third approach, of course, is always coming to one of us, one of the trusted healthcare providers that you have, either your child's pediatrician or their family doc, nurse practitioner who takes care of them. Just having them, bringing them in for an appointment to have an open or even sometimes a private conversation with their healthcare provider so that they can talk to them, because sometimes kids might not necessarily feel comfortable asking you a question, and in that environment they might be a little bit more open to getting it. And persistence, we don't say push it, but bring it up again, every now and then in a very non-threatening, non-pushy way as much as you can. I know kids always think their parents are being pushy, so you can create a space where they can where you can constantly sort of talk about it and really know why it's important. All of those things are just a few little tips that might help with that 14-year-old. So tell me a little bit about the 9-year-old twins, two of them.
Oh, so they really don't have a choice about the vaccine. As far as getting it, once we clear up some things, though, Dr.
Yeah,
Al. So my twins have always had reactions to vaccines,
sure.
always. So instead of like just sweating in the injection site, no matter the location, the whole extremity will swell.
Yes,
Um, and that was my concern. So when I took them to their pediatrician, I brought that concern up and we created a plan to be able to um, rule out if it will be safe for them based on their allergies
sure.
to get the vaccine and how we can navigate that whole situation. Um,
Absolutely.
I'm hoping that we can it'll be just like the other vaccines where it's some mild discomfort and we can just weather through that and they can still get vaccinated because I
Absolutely.
want them to be safe.
Yeah, and one thing that you said, particularly as it pertains to allergies, because I get a lot of questions about kids who have allergies or asthma, whether it's safe or not. The difference in what you just mentioned is that your kids had reactions to previous vaccines. And so in that case, it's always important to talk to your child's healthcare provider specifically about what those reactions were so that you can develop a plan and determine whether or not it's safe for your child to receive the vaccine. Generally speaking, if kids have food allergies or pollen allergies, what we call environmental allergies, those kids have done very well, and it's been safe for them to receive the vaccine. But if your child has a more severe allergy, particularly to a previous vaccine, it's really important to talk to your healthcare provider about that, just like you did, and to develop a plan for making sure that your child gets the vaccine in a safe and effective way. I also encourage parents to make sure that they mention that one of the things that you will receive when you go in to receive the vaccine is a checklist, and we'll ask you specific questions about allergies, reactions to previous vaccines, and this helps us to know what we need to do. Do we need to observe you for a longer period of time after you receive the vaccine to make sure that you're safe and that there are no issues with the vaccine? But generally speaking, if your kid has food allergies or asthma, even environmental allergies, like we mentioned, then they've done very well, and it's generally been safe for them to receive the vaccine. So it sounds like you definitely had some good experiences so far, and I commend you for talking to your healthcare provider about the vaccine. So so thank you for sharing your story with us. Imani, I don't know if there are any additional questions that might have come up in the chat that we could answer.
Yes, thank you, Dr. Al. So there is one question. Can you talk about the importance of getting vaccinated now that we have emerging variants such as Delta and Omicron?
Absolutely, and there's been a lot in the news about all of these new variants that are coming out. It's not unusual for a virus to mutate and to have different variants. So this isn't something that comes as a big surprise to us. And the latest one that we're hearing a lot about is Omicron, and we're really looking at this and making sure that we're tracking it. And I think that over the next 2 to 3 weeks, we'll have a lot more information about how effective the current vaccines are against it. But just like we found with Delta, there was a lot of protection in the current vaccine that we've been administering. And so we strongly encourage people, the most effective way to protect yourself from COVID is to get the vaccine. And in those instances, if you're fully vaccinated, that offers you the best chance against Omicron or any other variant that might come up in the future.
Thank you, Dr. Al. Can you
Sure.
also tell us what kids can get vaccinated? There's been a lot of changes to the rules and who's been approved for vaccination.
Absolutely. Kids down to the age of 5. If your kid is 5 years old, your kid can get vaccinated. Right now, there are some clinical trials looking at the safety and efficacy of the vaccine from kids from 6 months to 5 years, but we're not there yet. But if you have a 5-year-old child, that child can receive the vaccine. 5 years old and older can get the vaccine.
Thank you. And for the older kids, can you talk to us more about boosters? It's been a while since they were approved for vaccination. Should they get boosters?
Absolutely. And so that's a great question. And as you know, boosters have now been approved for kids down to the age of 16. So anybody can get a booster. And the simple rule is that if it's been 6 months since you received either the Pfizer or the Moderna vaccine, you can get a booster. Of course, we know that Pfizer is the only one that's approved down to the age of 16. For older, if you're 18 and above and you receive the Johnson & Johnson vaccine, then it's only a 2-month period that you need to wait before you can get a booster. But anyone who's down to anyone 16 and older who received the last part of their initial series 6 months ago, they can get a vaccine, and it's something that we at Community of Hope are doing. As you know, Imani, and you and I have participated in several of these vaccine events. The nice thing about Community of Hope is that if you bring your 5-year-old in or your child in to get their initial vaccine, and it's been 6 months since you've gotten your last one, you can get your booster at the same time. And we're really focusing on providing vaccinations for the entire family to do our part to fight this pandemic.
Thank you, Al, for bringing that point up. And I will take a moment to share that we do offer vaccines across all of our sites, Monday through Friday. And you can always contact us either by our website, our numbers listed there at cohtc.org, or giving us a phone call at 202-470-3081.
I have a question for you right quick, if I may.
Okay, Dr. Al.
So as a nurse who actually administers this vaccine, and you've given all types of different vaccines, have you seen any difference in the response that kids have had compared to all the other routine vaccines they get?
Well, that's a really good question. So as Dr. Al mentioned, since we are a family practice, before COVID, immunizations was a big part of our service line, particularly with nurses. I have not seen any difference between, the way kids react to getting their typical standard pediatric immunizations and COVID. In fact, I usually tell parents when they're concerned about side effects to treat it just like they would if it was as they did if they got like their MMR vaccine or their chickenpox vaccine when they were younger. They might get a mild fever, they might be a little sore on their arm, usually nothing that like a sticker, an ice pack, and a hug can't heal. But if that doesn't help, we talk to the parents about appropriate Tylenol and ibuprofen dosing if like the child has like any aches or pains or mild fever. And then, of course, we counsel the parents on signs and symptoms of adverse reactions, which are different from side effects. So side effects are things that we expect that can come up from getting a vaccine. And adverse reactions are things that we don't anticipate, but are very rare. So we want to educate our parents anyways on that. I've also noticed that our younger kids handle the shot a lot better than our older kids. So
right.
there's just something about like our under 10-year-old crew who are troopers, and maybe they're just so close to that age where they were getting tons of shots.
Right.
But it's been the 13, 14, 15-year-olds that you've sometimes had to, bring them back down before they get their vaccine.
Absolutely. And that's such a big part, and for me, I really think that just having kids back in school this year, having seen the impact that being out of school for most of last year had on our kids, many of them fell behind. Distance learning just doesn't work for a lot of people. And so being able to get them back in-person learning in that safe environment is just really important. So I'm really happy that we're able to offer this at all of our locations for all of our patients.
If there's another question, there's other questions that have come in now. So another question from the audience. I just heard from my teen's school today that they were closely exposed and have to get tested. I wanted them to get a booster soon. What should I do?
Absolutely, yeah. And so one of the things about, and this was before we actually had the vaccine for the pediatric population, kids were being sent from school all the time to quarantine after there was an exposure. We know that across all jurisdictions, if you're fully vaccinated and asymptomatic and you get exposed, in most instances, you don't have to quarantine, which is a great thing. If you're thinking about getting a booster shot for your kid, you can do that, even if they've been exposed, as long as they're not symptomatic and as long as they just haven't tested positive recently. So your kid is perfectly fine to get the booster. If your child is fully vaccinated, which it sounds like they are because they are eligible for the booster, then more than likely they don't even have to quarantine as long as they are asymptomatic. And so it's important to check in with the school's regulations, but in most instances, and even in DC, if you're fully vaccinated and you have a close contact with someone who's positive, you don't have to quarantine, but they do recommend that you get a test about 5 days after the exposure. So all part of all the reason to get vaccinated so that you don't have to miss out on classes or miss out on some of those important events that happen at school. So very good question.
Yes, and in addition to that with the booster, so it's not like the primary series where you have to wait 2 weeks before you consider yourself fully immunized. Data shows that booster is effective immediately. So if you get that booster, you're boosted. There's no 2-week waiting before the immune response.
Absolutely, very good point.
We have another question from Veronica. Can we get some guidance on what to do if our toddler has been exposed to COVID at daycare, and what would be best for other children in the household attending other schools? Does this mean we all have been exposed? Dad and I are vaccinated. Our 7-year-old has 1 of 2 vaccine doses. Thank you.
Sure. So this all goes back to the definition of fully vaccinated. Now, if you have a toddler, then your toddler is probably too young to receive any of the vaccines, and so the quarantine rules are probably different than for if you're fully vaccinated. Again, the best place to check would be with the school, because every school has specific guidance for these situations. And so I don't want to give, but what I'll give you would be general advice. Again, making sure that you follow up with the school. But if you're unvaccinated, or if you've only received or partially vaccinated, and then generally speaking, that you have to quarantine after a close exposure. And typically the recommendation is 10 days after the exposure before you can go back, and 24 hours with no fever or no symptoms. Again, it can get a little complicated, but but generally speaking, if you're partially vaccinated or unvaccinated, then you will need to quarantine. The time period can differ based on the community spread and the guidelines and the guidance of your school or your child's particular daycare. So I would definitely check in with them before making any further decisions. So.
Thank you. Our next question, what is the difference between the 12 and up vaccine versus the 5 to 11 vaccine?
So the biggest difference really is the amount of vaccine that's given. When we look at the Pfizer, the components are exactly the same, but the 5 to 11 vaccine is about 1/3 the quantity of the older vaccine. And I think from a nursing perspective, there's a different color to the cap of the pediatric vaccine, just to make sure that that there's no difference whenever you administer it, just to make sure that we decrease the likelihood of one age group getting the wrong vaccine. But the components of the vaccine are exactly the same. Very good question.
Thank you. Next question. What could happen if my kid does not get vaccinated?
If your kid does not get vaccinated, then you definitely increase the likelihood that they will contract the disease, particularly if they're exposed to someone who tests positive. And as I mentioned at the top of the hour, initially we didn't think that this was a big deal for younger kids. We figured that if they caught COVID, it would just be like a cold and they would be fine. But just like any other vaccine preventable disease, we don't know exactly. We've had kids who have been previously healthy who've contracted COVID, ended up in the hospital. Some of them died. And these are kids who had no pre-existing medical conditions. And so for me, it's not worth taking that chance on your child's health or their life. We know that the vaccine is safe and effective, and this is and decreases the chance that they'll either contract the disease or have a very, very severe outcome from their disease. We know that it's about 92% effective. And so that with those types of odds, I would definitely strongly encourage parents to get the vaccine, just so that you don't have to deal with a hospitalization, possible exposure to other family members, community spread, all these things that we need to do to try to decrease the likelihood that someone else will contract this virus and that it will spread and mutate and continue in our community. And so it's part of all of our responsibility to do our part to really decrease the spread of COVID-19. So again, the recommendation that we're making from a healthcare perspective is vaccinate, 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 because we don't know and we can't predict who is going to get the sickest, who's going to be in the hospital, who's just going to have mild symptoms.
Thank you, Dr. Al. So someone asked from the audience, when can my nieces and nephews under age 5 get vaccinated?
Well, I can tell you that the clinical trials are happening as we speak. And just like this vaccine, we want to make sure that it's safe and effective before it's rolled out. And the vaccine development process takes some time. Before we received authorization for the 5 to 11-year-olds, it was tested in thousands of kids to make sure that it was safe and effective. And we're going to apply the same, and they're applying the same type of careful testing before we recommend it for this age group. So it's hard for me to give a timeline, but just know that the clinical trials are happening as we speak.
Thank you. We currently don't have any more questions right now in the chat. Latoya, do you have any additional questions for Dr. Al?
I did have one question. Are there any other conditions or health concerns that parents should take in consideration when speaking with their provider about getting their children vaccinated?
Yeah, that's a really good question, Latoya, because and it's a reminder for me to sort of put a disclaimer that most of the information that that we're talking about tonight should always be you should always talk about these. You should always ask your healthcare provider a lot of these same questions, because as you know, every child is different. You have 4, and I'm sure they're all quite different with a whole different personalities, different issues, and everything else. It's always important just to talk to your healthcare provider about risk, benefits. Your healthcare provider knows your child's history, has access to all of that information, and can help you make the best informed decision for your family. Your trusted healthcare provider is probably the best place to go to receive the vaccine. If they don't have it in stock, they can refer you to a wonderful place like Community of Hope, where you can receive the vaccine, because as I might have mentioned, we are offering the vaccine for kids 5 and above at all of our sites, and we'll provide some information on how to reach us as well. But it's always important to get the best information about your child from your child's healthcare provider.
Yes, and as Dr. Al stated, Community of Hope, for those who joined a little late, offers vaccines Monday through Friday in all of our all of our sites, and you can call 202-470-3081 to schedule an appointment. We have another new question in the chat. Should my kids stay masked during the holidays if they are only partially vaccinated when hanging out with the relatives?
Right, and that's a really good question. My recommendation would certainly be to do so if they're partially vaccinated, particularly if you don't know the vaccination status of the relatives. And generally speaking, with large family gatherings, oftentimes you might have several different people coming over and visiting, and so that's probably the safest thing to do. If you're in a smaller contained environment, if it's just the immediate family there and you know that everyone's vaccinating, then you can probably relax the mask guidelines. But in larger gatherings, particularly those with unvaccinated individuals, it's probably best to err on the side of caution.
Thank you.
Sure.
I'm just giving a moment for another question to pop into the chat.
Yeah, what I'm most proud of, and something that I really want to reiterate while we wait for one, is the fact that a Community of Hope, although the topic of tonight's conversation really is the pediatric vaccine, I'm most proud of the fact that parents who bring those kids in can receive the vaccine as well, because we know that this isn't just a disease that affects kids. It's not just a disease that affects middle-aged folks or old folks. It's a disease that can affect us all. And so the best way to end this pandemic and to really and truly protect ourselves is for everyone in the family who's eligible to receive a vaccine to do so. And so at Community of Hope, we offer vaccines for the entire family, so at all of our sites.
Dr. Al, can you talk about whether or not it's safe to get multiple vaccines at one time? Like, can a parent get their child's COVID and flu vaccine at the same time, or their regularly scheduled vaccines, the COVID vaccine?
Absolutely. Great question. And we get that one a lot as well. But it is perfectly safe to administer the COVID vaccine at the same time that your child receives their regular childhood vaccines. If they're due for flu, it's we strongly encourage all kids to receive the flu vaccine. And it's perfectly safe for them to receive both of those at the same time. I received both of mine at the same time this year. Just wanted to get it all done one at a time, all get it done and be over with, rather than having two separate visits. And I'm here, I'm fine, and so far, I've had a really safe, healthy winter. So I'm grateful for that. But yes, you can do all routine vaccines along with the COVID vaccine.
Okay. Well, thank you so much, Dr. Al and Latoya, for joining us tonight. It looks like we've answered all of the questions. So again, for those who are out there, we're Community of Hope. We're located all across DC, and we offer COVID vaccination for everyone 5 years old and up. You can give us a call at 202-470-3081 to schedule an appointment. It was nice having you all, and I hope everyone has a great evening. Thank you.
Thank you. Stay healthy.